Most men don't notice it at first. The change is subtle, gradual, easy to dismiss. They wake up feeling slightly less rested than they used to. The energy isn't quite there. The sharpness has dulled. And that reliable morning response, the one they used to count on without thinking, it's becoming inconsistent. Most blame their age, some blame stress. A few wonder about their hormones. But almost none of them think to look at their dinner plate, or more specifically, at the clock when they finish eating. I'm Dr. Emily Carter, board-certified urologist. And over the past 15 years, I've seen this pattern repeat itself in thousands of men over 50. A pattern so common, so consistent, that it stops feeling like coincidence. Because here's what most men don't realise. The time you eat your last meal of the day doesn't just affect your digestion, it affects something far more fundamental. Your body's entire overnight repair system, the hormonal cascade that determines how you wake up, how you feel, how you function. And when that timing shifts, even by an hour or two, the effects ripple through every system that matters. Sleep architecture changes, hormone production stutters, blood flow patterns adapt, and over time those adaptations become the new normal. Until one morning, you realise the old normal isn't coming back. This isn't about calories. It's not about what you eat. It's about when your body is forced to deal with it. And what that timing does to the delicate circadian machinery that keeps a man vital. Let's start with what most men do. What feels normal, natural, harmless. You work all day. You come home tired. You eat around 7, 8, sometimes later. You finish your meal. You feel satisfied. Maybe you sit on the couch, watch TV, read, scroll your phone. 2-3 hours pass. You start feeling tired, so you brush your teeth, get into bed, and you fall asleep. This is what millions of men do every single night. And on the surface, nothing seems wrong. You're eating dinner, you're going to bed at a reasonable hour, getting your 7, maybe 8 hours of sleep. But here's what most men don't realise. Your body doesn't care about the clock on your wall. It cares about something older. Something more fundamental, a biological clock that's been running for hundreds of thousands of years. And that clock has a very specific expectation. When the sun goes down, digestion should be winding down. The body should be shifting out of energy consumption mode and into repair mode. Hormones should be preparing for their overnight rhythm. Insulin should be dropping. Cortisol should be low. And testosterone production, the kind that happens during deep sleep, should be ramping up. But when you eat late, when you go to bed with a full stomach, with insulin still elevated, with your digestive system still working, that entire rhythm is disrupted. Your body can't do two things at once. It can't fully digest and fully repair. So it has to choose. And digestion always wins. Because in the short term, digestion is survival. Repair can wait. Except repair doesn't wait. It gets delayed, shortened, compromised. And this is where the problem begins. Not with a crash, not with sudden dysfunction, but with a slow, imperceptible erosion of the overnight processes that keep a man functioning at his best. Let's talk about what happens inside your body when you eat late. Not the obvious things, the hidden things. When you eat a meal, your blood sugar rises. Your pancreas releases insulin to manage that sugar. And as long as you're awake, moving, digesting, this process works smoothly. But when you eat late, when you lie down with insulin still elevated, your body enters a strange metabolic state. You're trying to sleep. But your metabolism is still in fed mode, still processing, still working. And here's the problem. Insulin doesn't just manage blood sugar, it suppresses other hormones, including growth hormone, including testosterone. Because your body can't be in fed mode and repair mode at the same time, it's biologically impossible. So when you go to bed with insulin elevated, your overnight testosterone production, the kind that's supposed to peak during deep sleep, gets blunted, not eliminated, just reduced. Slightly, consistently, night after night. Most men don't feel this right away. But over weeks, over months, the cumulative effect becomes noticeable. Energy feels lower. Recovery feels slower. Morning function feels less reliable. And because it happens gradually, most men adjust. They accept it as normal. As aging, as just how things are now, but it's not aging, it's timing. Now let's talk about what happens to your nervous system. Your body has two modes, sympathetic and parasympathetic, fight or flight versus rest and digest. And these two systems are supposed to trade off throughout the day. But when you eat late, when your digestive system is still active while you're trying to sleep, your body stays partially stuck in sympathetic mode. Because digestion requires blood flow. It requires energy. It requires activity. And that prevents your nervous system from fully switching into parasympathetic mode, the mode where deep sleep happens, where REM sleep happens, where the body's most intensive repair work takes place. This is why men who eat late often wake up feeling unrested, even if they slept 8 hours, even if they didn't wake up during the night. Because the quality of that sleep was compromised, the depth was reduced, and one of the first things to suffer is morning erections. Because those aren't random, they're not about arousal, they're a direct marker of REM sleep quality and overnight parasympathetic tone. When REM sleep is disrupted, when parasympathetic activity is suppressed, those spontaneous nighttime erections decrease, first in frequency, then in firmness. Then sometimes they stop altogether, and most men, when they notice this, think it's a circulation problem, or a hormone problem. They don't connect it to the fact that they ate dinner at 9 o'clock and went to bed at 11. Because why would they? It seems unrelated. But it's not unrelated. It's directly connected, through the same nervous system pathway that controls both digestion and erectile function, the same hormonal rhythm that manages both insulin and testosterone. Let's go deeper. Let's talk about blood flow. When you eat, blood is redirected to your digestive system. Your stomach, your intestines, your liver, they all need increased blood flow to process food. And for a few hours after eating, a significant percentage of your cardiac output goes to your gut. But here's what most men don't realise. That blood has to come from somewhere. And when you're lying down, when you're trying to sleep, that redirection creates a problem. Blood flow to extremities decreases. Blood flow to the brain decreases slightly. And blood flow to the pelvic region, the area that controls erectile function, also decreases. Not dramatically, just enough to matter. Over one night, this isn't a problem. Over months, over years, this pattern of reduced overnight blood flow to the pelvic region leads to something called endothelial adaptation. The blood vessels in that area, the ones that need to stay flexible and responsive to support firm erections, they adapt to lower flow. They become less reactive, less sensitive. And once that adaptation occurs, it's not easily reversed. Because your vascular system has learned a new normal, a reduced baseline. This is why so many men over 50 start experiencing erectile changes that seem to come out of nowhere. It's not sudden. It's cumulative. Years of late dinners. Years of going to bed in digestive mode. Years of reduced overnight blood flow to the exact area that needs consistent circulation to stay functional. Let's talk about cortisol. Cortisol is your body's primary regulatory hormone. It controls inflammation. It manages blood sugar. It coordinates your circadian rhythm, and it's supposed to follow a very specific daily pattern. High in the morning, that's what helps you wake up, then gradually declining throughout the day, lowest in the evening and overnight. That low cortisol is what allows melatonin to rise, what allows deep sleep to occur, what allows testosterone production to peak. But when you eat late, when your blood sugar spikes close to bedtime, your body has to release cortisol to help manage that sugar. Especially if you're eating carbohydrates, especially if your insulin sensitivity is already reduced, which it naturally is after 50. That cortisol spike disrupts everything. It blocks melatonin, it prevents deep sleep, it suppresses overnight testosterone production, and it shifts your entire circadian rhythm slightly forward. Over time, this creates a chronic low-grade stress state. Not the kind you feel emotionally, the kind that shows up in blood work as slightly elevated inflammatory markers, slightly higher fasting glucose, slightly reduced testosterone, all subtle, all within normal ranges, but all pointing in the wrong direction. Now let's talk about the 3-hour window, because this is where the science becomes specific. Research into circadian biology has identified something called the fed-fast transition. It's the period your body needs to shift from processing food to entering a true fasted, repair-focused state. And that transition takes time. Roughly 3 to 4 hours, depending on meal size and composition. If you eat a large dinner with carbohydrates, protein and fat, your body needs at least 3 hours to process that meal, to clear the insulin, to finish the primary digestive work, to shift your metabolism from fed mode to fasted mode. And only once you're in fasted mode can your body fully activate its overnight repair systems. The growth hormone release that happens in deep sleep, the testosterone production that occurs during REM cycles, the cellular cleanup processes that require low insulin to function properly. But if you eat at 8 and go to bed at 10, you're only giving your body 2 hours. Not enough. Your insulin is still elevated when you lie down. Your digestion is still active when you try to sleep. This is why the 3-hour window matters. Not as a hard rule, not as medical advice, but as a biological reality. Your body has a timeline, and when you don't respect that timeline, the processes that depend on it get compressed, shortened, compromised. Most men can tolerate this for years without noticing. The body is resilient, it adapts, it compensates. But eventually, those compensations start to fail. And when they do, the symptoms don't feel like a food timing issue. They feel like aging, like decline, like something that can't be changed. Let's talk about what tends to happen when men change their eating window. Some men finish dinner by 6, some by 7. The specific time matters less than the gap between last bite and bedtime. 3 hours minimum. 4 is better. What tends to happen when men create this gap is subtle at first. Sleep feels slightly deeper, not dramatically different, just cleaner, more restorative. They wake up feeling more like they actually slept. Morning energy often shifts within the first week. Not a surge, not a transformation, just a baseline improvement. Less grogginess, clearer thinking. And then, over a few weeks, other things start changing. Morning erections, if they'd been declining, sometimes return. Not every day, not as strong as in their 30s, but present, consistent, reliable in a way they hadn't been. This isn't magic, it's not a cure, it's your body responding to better overnight conditions. The testosterone production that was being suppressed by late-night insulin, it's less suppressed. The parasympathetic tone that was being blocked by active digestion, it's less blocked. The REM sleep that was being shortened, it's less shortened. Small shifts, incremental improvements. But when you're 50, 60, 70 years old, incremental improvements in the right direction are meaningful, because the default trajectory is incremental decline. Now let's talk about what happens when this pattern continues. When men don't make the connection, when they keep eating at 8, 9, 10 at night and going to bed soon after, your body adapts to chronic metabolic stress the same way it adapts to chronic physical stress. It compensates, it finds workarounds, it maintains function as long as possible. But every compensation has a cost, and eventually, those costs accumulate. The first systems to show wear are usually the most sensitive ones. Vascular health, erectile function, sleep quality, energy regulation. Not because these are weak systems, but because they depend on tight hormonal and circulatory coordination. And when that coordination is disrupted nightly for years, the effects compound. Endothelial dysfunction, the reduced flexibility of blood vessel walls, often appears years before cardiovascular disease. But it shows up first in areas with the smallest, most delicate vessels, the erectile tissue. This is why erectile changes are sometimes called the canary in the coal mine. They're an early warning, a signal that vascular health is declining in ways that aren't yet visible on routine tests. But most men don't think backward. They don't ask, what was I doing 5 years ago that might have set this in motion? They think forward. What can I take now to fix this? And so they look for supplements, medications, solutions that address the symptom without touching the pattern. Let's talk about what doctors typically see. A man comes in, he's 55, 60, maybe older. He's tired, his energy is low, his morning function has declined, he's not sleeping as well, he feels like something is off. The doctor runs tests, testosterone levels, thyroid function, basic metabolic panel. Everything comes back normal. Maybe testosterone is on the lower end of normal, maybe fasting glucose is slightly elevated, but nothing alarming. So the doctor says, this is normal for your age, or let's try testosterone therapy, or here's a prescription for erectile dysfunction, but almost never does the conversation go here. Tell me about your dinner. What time do you eat? How long before bed? Because that question doesn't fit into the standard diagnostic model. It's not a lab value. It's not a prescription. It's a lifestyle factor, which most doctors are trained to think of as secondary. But what if it's not secondary? What if, for many men, The timing of their last meal is one of the most important variables affecting their overnight recovery, their hormone production, their long-term metabolic trajectory. This isn't something pharmaceutical companies study. It's not something that generates revenue. It's not something that fits neatly into a 10-minute office visit. But it's there, in the research, in the patterns, in the physiology. Let's talk about what this means for the average man, the one who works long hours, who eats dinner with his family, who doesn't think about circadian biology or insulin timing, who just wants to feel better, to function better. For that man, this information is both simple and complicated. Simple because the change is straightforward. Eat earlier, create a gap. Complicated because life doesn't always cooperate. Work schedules, family routines, social expectations. And so most men, even when they hear this, even when they understand it, they don't change, because changing feels hard, inconvenient, unnecessary when they're not in crisis. But here's the thing about decline. It doesn't announce itself. It doesn't arrive with a clear beginning. You don't wake up one morning and think, today is the day my vitality started fading. It happens in the margins, in the accumulation of small repeated patterns, and by the time the decline becomes obvious, the pattern has been in place for years, maybe decades, and reversing it, if it can be reversed, requires more effort than preventing it would have. This is why awareness matters, not to create fear, not to promise solutions, but to offer a lens, a way of thinking about your body that goes beyond symptoms and medications, that asks, what am I doing every single day that might be quietly undermining the very things I want to preserve? For many men, the answer is dinner timing, not the only answer, not the complete answer, but a significant one that compounds over time, one that intersects with every other system that matters, sleep, hormones, circulation, metabolism, and one that, unlike age or genetics, is modifiable, not easy, not always convenient, but possible. Let's talk about what doesn't change, because this is important too. Changing dinner timing isn't a cure for aging. It doesn't reverse decades of metabolic stress. It doesn't undo vascular damage that's already occurred. It doesn't raise testosterone to youthful levels. It doesn't eliminate erectile dysfunction if the cause is primarily circulatory or neurological. What it does is optimize the environment. It gives your body the best possible conditions to do what it can still do, to produce the hormones it can still produce, to repair the tissue it can still repair, to maintain the function it can still maintain. And for some men, that optimization is enough to notice a difference. For others, it's one piece of a larger puzzle. For some, it comes too late to reverse damage. But almost never does it make things worse. The downside is convenience, the sacrifice of eating whenever you want, the social awkwardness of finishing dinner while others are still eating, the discipline of planning ahead instead of reacting to hunger. But these are trade-offs, not side effects. And every man has to decide whether the potential benefit is worth the certain inconvenience. Most men, when they're feeling fine, when decline hasn't yet become obvious, they decide it's not worth it. And that's understandable. Change is hard when the consequences of not changing are invisible. But for men who are already noticing changes, who are already feeling the decline, this is one of the simplest, most fundamental shifts they can make. Not easy, but simple. Finish eating earlier, create space, let your body do its overnight work without interference, and then observe. Not with expectation, not with attachment to a specific outcome, but with curiosity, with attention to subtle shifts, to patterns that emerge over weeks instead of days. Because this is how biology works, slowly, cumulatively, in ways that are easy to miss if you're looking for quick fixes. Let's bring this back to where we started, the man who wakes up feeling less vital than he used to, whose energy isn't there, whose morning function is inconsistent, who blames his age, his hormones, his stress. What if the problem isn't any of those things? What if it's simpler? What if it's timing? What if the dinner he's eating at 8 or 9 every night, the meal that feels normal, harmless, routine, is the pattern that's quietly disrupting his overnight recovery, suppressing his testosterone production, blunting his REM sleep, reducing his parasympathetic tone, compromising his vascular health, night after night, year after year? Not in a way that creates disease, not in a way that shows up on a test, but in a way that slowly erodes the margin between functional and struggling, between vital and tired, between confident and uncertain. This is the hidden cost of eating late, not dramatic, not immediate, but real, cumulative. And for many men, modifiable. Your body has a rhythm, a timing, a sequence of events that's supposed to unfold every night while you sleep. Hormones rising and falling, systems turning on and off, repairs happening in a specific order, all coordinated by the oldest, most fundamental biological clock humans have. And when you eat late, when you compress that window, when you go to bed in fed mode, you disrupt that rhythm. Not completely, not catastrophically, but enough to matter, enough to compound, enough to become over years one of the primary drivers of age-related decline. Most men never make this connection. They accept the decline as inevitable, as just what happens when you get older. And so they adjust, they accommodate, they lower their expectations. But what if you didn't have to? What if this one shift, this one change in timing, could slow that decline, could preserve function longer, could maintain vitality deeper into your 50s, 60s, 70s? Not a guarantee, not a promise, but a possibility. One that doesn't require medication, doesn't require expense, doesn't require anything except awareness and discipline. The body always adapts, until it doesn't. Most men don't realise they've crossed that line until they're looking at it in the rearview mirror, until the decline that felt gradual suddenly feels steep, until the function they thought they'd always have is noticeably, undeniably reduced. And then they ask, when did this start? When did I lose this? And the answer often is years ago, in the pattern they didn't notice, in the timing they didn't think mattered, in the dinner they ate at 9 and the bed they climbed into at 11. Not every night creating a crisis, but every night adding to a pattern, a rhythm, a new normal that their body adapted to, until adaptation became limitation, and limitation became decline. Awareness usually comes after the change is already noticeable, after the pattern has already set in, after the body has already learned its new baseline. But sometimes, for some men, awareness comes early enough. And when it does, when they understand what's happening before it becomes permanent, they have a choice: keep the pattern, or change it. Most men think about dinner as fuel, as satisfaction, as routine. They don't think about it as a metabolic signal, as a circadian disruptor, as a pattern that could be shaping their vitality years down the line. But maybe they should, because the body is always listening, always responding, always adapting to the signals you send it. And one of the strongest signals you send, every single night, is when you eat your last meal. Your body hears that signal, and it adjusts, for better or worse, in ways you feel immediately, and in ways you won't feel for years. The question is, what signal are you sending?